Did you know tooth decay is the most common chronic childhood disease, despite the fact that it's entirely preventable? Well, Mary Coogan, Assistant Director of Advocates for Children of New Jersey, is here to share her outrage and insight on preventive measures parents need to take. Thanks for joining us today.
Thanks for having me.
I tease about being outraged, but we all should be. I mean, if something that's preventable.
Yes.
Let's talk about some very basic things that parents can begin to do when their kids are very young, before they're brushing their own teeth.
Well, the main thing is parents don't understand that you should be doing good oral health the first time the tooth erupts. So by a year, a child should actually be seeing a dentist. But parents can wipe out with a piece of gauze, wipe out their child's mouth. They should never put a baby to bed with a bottle that has anything but water in it.
That is a big
biggie.
Faux pas that parents do.
Right.
And why is that?
Because the sugar, and this is the unscientific explanation because I'm not a dentist, the sugar actually forms a bacteria and an acid in the mouth, and that's what starts to eat away at your enamel. And that's the little holes are what eventually become cavities.
Okay, so that just accelerates the process by the time they're 5 or 6.
Correct. And a lot of people, I know when I was younger, you didn't go to see your dentist till you started kindergarten or first grade. And now the recommendation is to have a child see a dentist by the age of 1.
I wanted to ask you about dental sealants. That's become a new fad, I guess. But they're promoting that a lot. Is that good or bad?
Well, I'm not an expert on that. My understanding is you actually can, it is a good preventive measure. It should be applied, though, by a dentist or a dental hygienist, someone who has knowledge. And I believe that you would only do that when you know the child has no decay in their mouth. So again, that should be done with a professional.
Okay.
But it evidently does work. But the fluoride varnish, which is something a little bit less, can be applied on a regular basis, and that helps prevent tooth decay as well.
Now, there's been a kind of a pushback on the whole fluoride thing.
Yes.
You have a camp that says, yes, fluoridation is good, and it's in our water supply in a lot of places, and the other camp saying, well, wait a minute, maybe not such a good thing.
Well, from everything that I've read, the research over the past 60+ years shows that fluoride in the water is an excellent preventive strategy. It works, it is safe because they monitor the levels, and that it's cost effective. I mean, to put fluoride in a community water system will cost you less than $3 per year per person. And when people don't always have access to dental care and they don't always have access to fluoride toothpaste, they can make sure their children's teeth are safe just by drinking the tap water with the fluoride in it. Some of the opponents feel that it might cause cancer, and the research doesn't support that. Some people would argue that their research is not good research, but it doesn't support the arguments they make.
Interesting arguments. Let's talk about what parents can do when their kids are real small. When the teeth first start coming in, you said go to the dentist at year 1?
Correct.
Or when they first erupt?
Correct.
But in terms of teaching them how to manipulate the toothbrush, the whole flossing thing, I mean, I'm assuming you do this in increments. Well,
you do. Once a child is maybe a year or so and you actually have a tooth, a parent can take a soft bristle brush and a little water and brush the child's teeth, and they can teach a child to do it. The other thing is, if you take your child to the dentist just to have the dentist show the child how to properly brush their teeth, that would be a fun visit. So you don't have to wait till your child's in pain to go to the dentist, where it then becomes a horrible experience. And I think many adults don't bring their children to the dentist because their own experience was not a good one. So you can brush with water. The recommendation is not to use fluoride until you know the child's not going to swallow it. And then you just use a little tiny bit when they know they're going to brush their teeth and then spit it out. But if a parent doesn't know that they are properly trained themselves in brushing their teeth, they should go to their local dentist.
You mentioned an interesting thing, that whole experience of going to the dentist. For many of us, it's just such a horrible experience that we convey that to our kids before making it perhaps a healthier thing.
We do. So I think it's very, a good practice would be for parents to find their local dentist and call them up and ask for that kind of just introductory appointment. And if they don't know a dentist, they should ask their pediatrician. Many pediatricians now who are seeing young children on a regular basis are actually sort of linking themselves or finding dentists who are comfortable treating young children. And so they can make that transfer and they can introduce the parent to the dentist who's willing to treat a young child.
So I want to throw out some tips here. Clean your child's mouth twice a day.
Correct.
Make the first dental visit when the first tooth appears.
Correct.
Never put the kid to sleep with a bottle.
Absolutely.
And routine exams every 6 months.
Absolutely.
All right. Good stuff. Thanks for
Okay.
coming on board and sharing with us.
Great start. Thank you.